Test, test. Can you hear me on Zoom? Marcos, can you hear me?
Yeah, we got you, Mark. Thank you so much. Appreciate it.
No problem.
All right, are we back? Okay, I apologize for anybody at home that was trying to monitor this. Okay, back online. As I mentioned earlier, the age range for eligibility is 12 to 17 years old. Those that are automatically not eligible for this program are those that are have committed misdemeanor or felony offenses under Welfare and Institution Code 707B. And as I mentioned earlier, those are violent crimes. It specifically calls them out. I think it's rape, robbery, murder, arson, and so forth. Having said that, law enforcement has the ability for any of the other crimes to recommend or deny access into that. So it gives us some flexibility simply because, as I mentioned, law enforcement that's investigating these crimes are going to have intimate knowledge, not only of the crime, the background of the individual, the family life, and whatnot. So we want to make sure that we have a good fit for this program. Oftentimes we see youth that are disengaged and sometimes not as excited to join programs like this. That does not preclude them from being eligible. Oftentimes it's just getting them out of their element, forcing them to go, so to speak. And once they're involved in an activity, they tend to adjust and really blossom and appreciate the program. I think it's like anybody that has kids. You want to get them involved in sports, and it's great at first, and then after a while they lose interest. You may keep them going, and then that interest picks back up. We kind of got to break through that barrier. So that's the same thing with this program. Research has shown that an adolescent brain is a little bit different than children or adults, and that is they're more impulsive. So that's where we look at these crimes that they're committing. And of course, their reactions, they're impulsive when they do it. It could be from peer pressure. It could be from a number of different things. So that allows us, as I mentioned earlier, law enforcement, because we're intimately aware of what's going on with them, that we can make that decision to recommend them or not. As I talked earlier about the statistics of it being a successful program, and data shows that 8 out of 10 youth who are referred into the program never go back into the legal system. So that's our goal. I think it's a misconception amongst the general public that law enforcement is just there to arrest. We really want the same things as all the community, and is we want a successful, healthy community. And we're limited sometimes in the tools that we have to make that happen. But programs like this really increase our availability to work with our youth and then ultimately reduce criminal activity in the long run. So we want to get those youth early. We talked about the benefits already of pre-booking diversion. Just some statistics here, and that is pre-diversion arrest, only 5 to 10% of youth go back into the system. I talked about the post-arrest diversion, which is what we typically had in the 90s and early 2000s. That rate of recidivism increases a little bit, roughly 5%. And then, of course, those involved in the justice system, anywhere between 20 to 50% return back into the justice system. And certainly, I would imagine if we were comparing, and this is just my personal opinion, youth versus adult recidivism rate, I think the adult recidivism rate would be much higher. And obviously, the goal is if we can get them early into the system, that they're not going to turn into those adult statistics. I mentioned the partnership that we have with not only with the county as far as juvenile probation and the youth diversion, or I'm sorry, the youth development committee, but also our local center here is Flint Ridge Center. They contract with the county, so the youth that we would send from South Pasadena would be going to the Flint Ridge Center in Pasadena. They have a number of resources to connect the youth with mental health programs, with counseling, with mentorship, and then ultimately we've even seen them reach out outside of their box and connect them with other county resources to help find jobs and other types of resources that those kids may need. And that is the end of the presentation. I'm open for questions. As I mentioned, this was just an informative report to let the community know what type of program we have entered into and that it's available to those that may need it. So I'm happy to answer any questions the commission may have.
I don't have a question at this point. However, I believe that this program is very important to help the young people before they get into real trouble. I remember from past years, I'm talking about 20 years or so, when there were problems with some of the youth and the parents, both of them were involved in their business. They were working and they just were not aware of what was going on with their children. And there was one particular case where there was this very violent young man, and when the police contacted him, they say, this is a serious problem here. The parents said, there's no problem at all. So anyway, they went to the room, and the kid had the entire room filled with gang paraphernalia and weapons. And the parents were not aware of any of this. So I think this program is so important before the children get into problems like the 707 that you mentioned, the serious ones, to help them through this particular hump they're going through. And they're going through the age where it's so common for them to play the dare game. I dare you do this, I dare you do that. And it's such a vicious circle because many of the dares are so poorly thought, so badly thought of, and they can cause so much harm and damage. So I think this is a very commendable program.
Yeah, Chief, the example you gave was a young person locally that put something. If there's something occurs in the future, or let's say you've heard those stories where young men in particular are getting a face of a young woman and then putting it on these sites where they're imposing their face on the body of a grown woman. Yes, in order to get the young person into the program, you have to get a buy-off from the parents of the victim, or does the police department make that decision alone?
No, the police department, it obviously helps if we get the parent buy-in. I mean, that's really about it. But the alternative is the justice system. So it is up to the police department to put them through the program, but we still reach out. Like in this case, we reached out to the individual's parents, and they were more than willing. And talking with a lot of the other agencies, they've had the same results. As typically parents are willing because it keeps the child out. I mean, there's really the alternative is not good, right? So most of the parents coming across are more than willing to do this. But yes, it is completely up to the police department to recommend them. And if we do recommend them, they're obligated to go. Otherwise, it reverts back to the justice system. So, and then again, as you know, in the example you gave, obviously that's a pretty significant, maybe not a violent crime, but a significant crime where we are almost like revenge porn. You know, where we're seeing youth do things that we would have never imagined, 10 or 15 years ago. So that has implications. And that is something, when I say the law enforcement is intimate with the knowledge of the case, while it may only affect one, we still have a victim over here that needs restitution, right? So we want to make it fair for everybody. as much as we can. You know, that's not always the case, but we certainly don't want to minimize the crime or the impact to the community either. So it really is a delicate balance, and we have to look at all the factors when we make these recommendations. As I mentioned with the previous individual that we referred, we looked at the family background, we looked at his educational background, we looked at, you know, what his standing is in the community. And in that case, we felt very confident that this was a one-off, very poor decision. At the same token, if we had something that was significantly more impactful to the community, we would take all those things into consideration, as well as the impact to the victim. You know, what does that look like? Because ultimately, at the end, we've got to try to make that victim whole and a productive member of the society. What we don't want to do is victimize them again by minimizing the crime. So there's a lot involved in it. We want to take everyone's account into it, everyone that's involved, and it's not an easy process. But so far, as I mentioned, talking with all the other agencies, they've had tremendous success, and there's very little pushback from the community, from the suspects that are involved, or from the victims that have been involved. So, and typically these are minor crimes that we're talking about. Property crimes, and I say minor in the definition by the penal code. So property crimes, crimes of quality of life issues, those type of things. And I believe Commissioner Holguin has a question. I see his hand raised. Oh, got it. Okay, sorry.
Mr. Cervantes, I think Councilman Bergson may have had a comment as well.
Completely 100% free. It's paid for, well, it's paid for by the county, so it's free to South Pasadena. We do not pay a dime. We are not billed for it. This is paid for completely through and by the county. It is not related to the school district whatsoever. It is a complete 100% law enforcement related program. We can work with the school district, and there are certain instances where we may feel that well, in the cases that we work with the school district, I'll say it this way, there's usually a two-pronged approach, and that is an administrative side from the school district and then the law enforcement side. The school district has their policy and procedures on how they handle things, and sometimes we will relinquish the law enforcement side to that. But at the same token, when it is within law enforcement specifically, we will take that away from them and then do it on our own, and either make the decision on our own to recommend the justice system. And in this case, we would probably take it out of their hands and then refer it to diversion. It's two totally separate systems. If it was deemed necessary, then we could certainly reach out. We have the mechanisms in place to reach out to the school district and share that information, which frequently happens when we have a lot of our crimes or crossovers that occur on the school campus. So there's a lot of communication back and forth between either myself and the superintendent, through our school liaison officer and the staff there. So there's mechanisms in place if it need be that we can get that information and or share it. But in terms of getting their buy-in or something like that, no, this is strictly a law enforcement program. Mhm. It's both. So South Pasadena or the law enforcement agency that's recommending that youth would keep those statistics, as well as the well, I'll say Flint Ridge Center in our case would keep statistics, and then we would share them monthly. So we go back and forth there. We would track how many that we are putting into the program, and they keep track of how many complete the program, and then we share that information through the county monthly. So that way we know who's completing, who's not attending, who needs to be referred back to the justice system. And ultimately, at the end, it's referred back to South Pasadena to seal the juvenile's records.
For this organization in Flint Ridge, I presume that all the individuals interacting with the youth who were referred over there have been live scanned. They've been
Correct. That's verified and vetted through Los Angeles County Department of Mental Health and through their youth diversion program. So yes, they're accredited therapists and mental health care providers, as well as ensuring that they meet the minimum standards to work with youth.
And lastly, can we expect follow up, for example, on a annual basis or something in terms of the number of individuals who've been referred and their outcomes?
Absolutely. It's because it's a pilot program for South Pasadena. Our goal is to provide probably a 6-month number, and then after that, a yearly. And we're talking about how we're going to do that yearly report, and most likely, it seems most relevant to do it in our annual yearly report. There are a number of very similar type of programs where we keep statistics. I'm just going to throw out like our flock camera system, which is a license plate reader system. A lot of that information requires follow-up, and it's usually on a yearly basis. So rather than doing a plethora of reports, we try to combine it into one annual report and give statistics to the community that way. So something I certainly see some value, and that also allows us to go back and evaluate the program, make sure it's working, and that if sometime in the future, to the councilman's point, if there ever is a cost to South Pasadena, we can validate if in fact it is worth it to continue that program, or is there something new and better out. So. Okay. Are there any public comments? Sure.
Hey, Chief, good morning. Thank you. Thanks for the presentation, and sorry I couldn't be there with you all. I figured everyone would appreciate not getting coughed on. Chief, I think you answered this, but I just want to ask it a little more explicitly. Does participation in this program, or let me ask it a different way, I guess. If you participate in this program, is that a reportable event, like for a college application? Or I know, like, for example, for the bar examination, I had to report every speeding ticket, parking ticket I ever got. But I think you mentioned that the records are sealed for this, right?
That is correct. So it is not a reportable event. And that's the whole goal, is we don't want to take the action of a youth and have a long-term impact for their adult life. So that is one of the benefits of this program, is that once completed, South Pasadena will seal those records, and they will not be disclosed on any future applications or criminal history inquiry.
Got it. Thank you, Chief.
So we have one public comment. This is a program that's already implemented. We signed the MOA last month. Okay, thank you. Thank you.
Moving on to item number 3 on the agenda. Shannon Robledo, Police Lieutenant, will now make a presentation of the South Pasadena Police Department's Homeless Outreach Program.
First of all, good morning, commissioners, council members of the public. Today I'm going to talk about the homeless outreach program that we have here in South Pasadena. It's unique to South Pasadena. We started the program approximately 10 years ago, where we felt that we had a need to start assisting the homeless instead of arresting them. That was the trend back then, and we took a different approach to it about 10 to 12 years ago. Thank you. South Pasadena unhoused population. The Los Angeles Homeless Authority estimates that there are approximately 14 people experiencing homelessness in the city of South Pasadena. And you may say, well, 14, I see a lot more. These are the people that are actually sleeping on our streets. The other ones are transits that are coming to our city using our public facilities or just being members of the public. During the daytime, that increases to approximately 25, 30 unhoused subjects. 85% of the unhoused population in South Pasadena are males, while the other 15% are females. The average age of the unhoused subjects here that are living in South Pasadena are males from 38 to 65 years old. The females are 36 to 51 years old. Of the people that are substance abuse users, and that's approximately 80% of our unhoused population, the substance abuse by choice is 60% alcohol and 40% narcotics. Um, this is a big number, and it's very unfortunate, but 90% of the unhoused subjects here in South Pasadena have mental health issues, some way or form. And we're going to just talk about that briefly. We have a member of the Los Angeles mental health, um, the county mental health team here, and she's going to kind of explain her role in all this. The available resources for the unhoused population here in South Pasadena are the South Pasadena Homeless Outreach Program. Those are members of our department that go out there and specifically handle homeless outreach calls. The other available resources are the Los Angeles County Department of Mental Health Evaluation Team, which is the West San Gabriel Valley mental health team. The Los Angeles Center for Alcohol Drug Abuse, they're also known as LACADA, and you'll be hearing that a couple more times. Holy Family Giving Bank, which supplies people in need with daily lunches Monday through Friday. We also have the LASA Homeless Engagement Team, and how we obtain those is sometimes if someone calls 211 and reports homelessness, the LASA team will come out here. We also have the Path Metro team from the Los Angeles Sheriff's Department that are riding the trains and are on the platforms. And another one that I've failed to put on this slide is the host team. It's the Homeless Outreach Service team, and that is a grant through Measure H. And we have members from San Gabriel PD, Monterey Park PD, San Marino PD, Alhambra PD, and South Pasadena PD all converge in different areas and assist homeless population. So sometimes South Pasadena will go to Monterey Park or Alhambra because our homeless is so transient that we kind of see the same people within these local cities. The outreach frequency for each of these teams, and then I'm going to also let you know pretty much what it cost. The South Pasadena Homeless Outreach Program, the HOPE team, is available daily. The cost is assigning officers, and sometimes we do have overtime details if we're if there's going to be, say for instance, coming up, there's going to be some weather issues. We go out there and assist them and let them know where housing is available. The Los Angeles County Department of Mental Health Evaluation Team, they're available 4 days a week. And it's a program, it's a free program to our city. The Holy Family Giving Bank, there's no cost to the city, and they're available 5 days a week. LASA Homeless Engagement Team, they're available 5 days, and there's no cost to the city. The Path Metro Team, from LA County. There's no cost to the city. They're available 5 days a week. And there's also grassroots organizations that also assist our city's unhoused. And that's members of the public, and they organize food drives or what have you. I'm going to briefly speak about our Hope team. The South Pasadena Police Department's Hope team contacts the unhoused within the city and establishes a rapport with them. They strive to determine their needs and direct them to resources. Some of the resources, such as housing, mental health services, food, hygiene, clothing, and official documents. And when I say official documents, some people don't have proper identifications, social security numbers, so we're able to actually take them to the DMV and help them get their resources. What I'm going to do is I'm going to introduce you to Sony, and she's going to just briefly talk about the Los Angeles County Department of Mental Health Evaluation Team. Sony?
Hi, good morning. My name is Sony, and I'm part of the LA County Mental Health Department, the MET team. I'm assigned to South Pasadena one day a week, and I'm usually here on Tuesdays all day. And my role involves a co-response with law enforcement to resolve any mental health crises in the city. And that involves also offering resources, linking people to substance abuse programs. If they're ready to go, I can make that happen in like a 30-minute intake on the phone. Placing holds if necessary. A lot of the homeless also in the city sometimes are in mental health crises. So if they are ready or if they are in a lot of crises, we can also take them to the hospital. With all the 50-on-50s, which are the mental health holds that happen in the city, officers are now giving me that information. And then we do go with the HOPE team or any officer that's assigned to me. We go and follow up with the families or the clients themselves and offer them resources or any other help that they might need after their stay in the hospital so that they don't have repeated crises in their lives. This also helps save resources for the city, and also the client is taken care of on a long-term basis. A lot of this involves tracking also. So we make sure that I follow up on a regular basis with some of these clients who might need long-term care, or they were not ready the first time. So we follow up again to see maybe they're more receptive in the following rounds. That's pretty much my role. It's a co-response with law enforcement. I am assigned to other cities on other days. However, I am available to come back to the city if there is a call. So I'm available 4 days a week. However, I'm in other cities during the other 3 days. Thank you.
Great, thank you, Sony. It's just a great piece of the whole pie of just everybody cooperating to help the people that need it the most here in the city. I'm going to briefly talk about success stories, because our team, our city, the grassroots organization put a lot of work into helping these people. And what is the end goal? The end goal is to help people, right? So this is some of the success stories. The outreach team assisted an elderly man who had been homeless in Los Angeles for 5 years after being evicted from his apartment. The team provided the elderly man with transportation and access to a shelter where he is now receiving essential support services. And those are wraparound services. So we don't just drop people off at a shelter and say, okay, we help them. No, we give them wraparound services where they are assigned people to assist them to follow up with them. Another one, this is Sony's team. The MET team assisted a gravely disabled South Pasadena resident who was on the verge of being homeless. The family was giving up on this individual. The team coordinated with the subject's public guardian and a local hospital to secure long-term care for the gravely disabled individual. That person is now getting fully cared for, and the family was deeply grateful for the support. And this is when we put in our hard work, these are the great things that our team accomplishes, and I'm very, very proud of them. I know Chief is as well. Again, this is an informative report, and I'm open for any questions.
Yes, I have a question for you. And what you are talking about is such a good program because these people are the most underserved people in the whole community. And however, there is something else we need to take into account. And I'm a frequent customer or attendant to the public library, South Pasadena Public Library. And as you know, that place has nothing but women running it. So not long ago, there was this man that was just screaming and yelling right outside the door of the public library. He was having a mental episode. And it was so confusing. It was confusing for the people going into the library, plus the people in the library. So I have spoken to some of the librarians, or the folks working in the library, and they told me, oh, that's nothing. Sometimes they go in and they go into the bathrooms and, and they try to clean themselves and they make such a mess. And the different patrons from the library complain that the bathrooms are so terrible, such a mess. However, we cannot forget the kind of need these folks have. So, and it seems that every time I go there, I see different people. It's not just one. I see young people, I see older people, and I don't know if they all have mental problems. Some of them, I think they're so young that they need to refer to maybe like a Covenant House or somewhere where these people would be safe. But anyway, the problem is there. The library is so close to the train station, and it's a safe place. It's warm there. They're not cold, and they're not afraid to be assaulted. So it's one of those things where this program is so badly needed, but we need to make our population here aware that there is a program that helps the people that have mental breakdowns or problems, and where they can call to get assistance to these folks. I go by the Garfield Park, and there are many people there too that are homeless, and obviously many of them need help. And but most of our people do not need where to call or what to do. So if we would make more public to the people, to the residents, what it is, who they can contact without meaning any harm to them, that they won't be arrested, but giving them help. That's the main
Absolutely.
thing.
That's a great question, Commissioner. There's several ways to do it. You can obviously contact the police department. Our teams do briefings on a daily basis, and they talk about who's in town, who needs help, how many times we've been contacting the certain subjects. We get referrals with the mental health team. But member of the public can simply just call the police department. We'll go down there. We're trained. We're not handling it like we did 12 years ago. We're taking a softer approach. However, when there are crimes being committed, we are doing our due diligence with doing the arresting. And just because they're homeless, that doesn't mean they can't commit a crime, right? But we want to make sure that we take care of their needs. And so our teams do have resources. So if you contact the police department on the non-emergency line, our teams will go down there and they'll know what to do, and they've been trained what to do. We also have 211. You can call 211. They will send someone out. You could just within 24 hours, I believe they'll send someone out. So if someone's sleeping somewhere and they're going to be there for a little while, the LASA team will come out. There's another way to report it as well. It's called LA Hop. lahop.org. It's a, it's a program, and it simply takes about a minute to fill out, and you can give details on it. Again, it's called la.hop.org. And someone will come out within the 24 to 48 hours to assist those subjects that need the assistance. Thank you, Commissioner.
Yeah, Lieutenant, we've had a number of updates over the last couple of years regarding the homeless. And I know about a year ago, less than a year ago, Miss Billings, the library director, I don't know if she still is, but she expressed a number of concerns. She actually gave a presentation before the commission. And Chief Solinsky also spoke about that. The library appears to be just a hub where when they get off the train, they know, I don't know if word spreads, it usually does, that that's where they go to clean themselves up and avail themselves of resources. So she indicated that their staff is obviously not trained to deal with this. But is there, and of course, and there's nothing you can do because it's a public facility, you know, library anywhere in any city.
That's correct.
Yeah,
We have
so-
the people here are able to roam freely within
Yeah,
our,
they can
within
roam
our
freely and
city.
do it. They can do whatever they want, which is it's a bit scary as well for the people who have to work there and then the people that go in there, as Commissioner Cervantes said.
Mhm.
But does the city have any the ability, if there's a repeat offender that comes into the library and is more than just a nuisance, but is actually scaring the staff? I don't know if that's occurred. Maybe it has not occurred. But does the city or the county have any of it means to keep an individual like this out of the library if the staff feels like it's risen to a level more than just a minor nuisance?
Great question, Commissioner. Yes, there are some ramifications. So the library does have authorization to ban patrons from the location. It's done all the time. Depending on the severity, they'll do 30, 90, even a year-long ban from the property. The staff has been trained on how to handle that. I believe currently, Chief, is there a security guard within the library? There's a security guard within the library now that's helping enforcing those bans. But not only that, they're just being a presence within there to keep the people safe, right? We want to go to the library, and the goal is to learn and not to worry about our safety. But it has come to that, Commissioner. It has, just libraries across the country, but we are going to specifically talk about South Pasadena because that's where we're in. Yes, it's become a haven for unhoused people to go in there during the hot days. It has air conditioner. During the cold days, there's a roof over their head. So those are the resources that they're using, unfortunately. No, it was real recently, I think within the last month or so.
Again, I just want to applaud the police department's engagement with these alternate mechanisms of engaging people experiencing homelessness. I think the proactive engagement is helpful, but also potentially in scenarios where, other fire departments are employing things like tactical engagement and things are hairy in the moment. I think having a suite of options available to members in the field is beneficial, and also moves the conversation forward between different organizations, including law enforcement and mental health. And so thank you very much for helping to serve our community, and kudos to the police department for being forward thinking in this area.
Thank you, Commissioner.
Hey,
N- Not offhand, but I can get you those numbers, Chief.
Yeah, we'd have to look at, so the HOPE team, which is South Pasadena Police Department's internal program, that is overtime based. So we'd have to pull those numbers, but there's a significant cost to that because for all of you that are here, homeless outreach is a big source of activity for the police department. So what we typically have is our on-duty staff that will get dispatched to that. But over the last couple of years, with the increased daytime homelessness population that are coming into South Pasadena and using our resources, those calls have expanded significantly. So what we've done to augment that is, with Sony's help, is to put an officer on an overtime basis to assist her and to go out there and handle those calls specifically. A lot of those calls, they're not 5 or 10 minute calls. They're 1 hour, 2 hour, 3 hour calls. When you're dealing with the county, you're trying to find resources, places to take these individuals. It can take time. So what we found as a benefit is we have one specific officer that tends to work those details. He's become very familiar with a lot of our homeless population, with the procedures, and we found it as a benefit. And we've often looked internally at creating a position, a homeless response person, and making that a full-time position. A lot of people in the community have expressed support for that. We've seen value in it. Unfortunately, due to staffing, we haven't been able to make that materialize yet. When we're talking about, and I just kind of rounded out a little bit here, the San Gabriel Valley Met Team, that is a program, the COG, San Gabriel Valley COG, which is it's the Council of Government. So if we think of the county, the Board of Supervisors, each region has their subcommittee, which is the COG. Ours is San Gabriel Valley COG. They have sponsored the San Gabriel Valley Met Team to come out and handle homelessness and mental health issues. That's separate from what Sony does from the Department of Mental Health, right? So they come out, we've seen them out here for about 2 years now. South Pass has been part of the program. That's a $200,000 a year cost to us, and that the COG is currently paying. The challenge with that is, and this is like anything, they are the company that the COG has contracted with is a private company. Over the last, I want to say 5 or 6 months, they have not had a mental health clinician, so therefore they're not responding. So although we get the free service, it's great, but if they're not responding, it's really irrelevant, so to speak. So the whole concept of it was we were going to have the police department a dual response mode. That means law enforcement would go out with the mental health individual teams, and once the scene was secure and it was safe, we would pass those individuals off to the mental health team, and they would take and do the 5150 holds or find long-term care. Without that mental health professional there, and they're not coming, that really removes them from the scene. Now, on the other half, their other team, which is a homeless outreach team, they're out here all the time. They are fully staffed. They're in our community. They're mingling with people. But as we talked about, over 90% of our homeless individuals in South Pasadena have mental health issues. So it's only half of a program. That's where we've been fortunate to utilize Sony with the Department of Mental Health. She's been coming out nonstop. As she mentioned, we have her all day Tuesday, and she's busy. We keep her busy all day long, but she also comes out when she's with the other cities. If she's not doing anything there, we can place a call to her, and she will drive back into South Pasadena and handle that call. And then, of course, she's able to secure it, stabilize it, and then she'll come back out on her next Tuesday and then do the long-term follow-up. So if you watch the council meetings, Councilmember Cacciati has been a proponent for a significant period of time on homeless outreach, and we're really looking at the value of being a member of the COG, or looking at alternate funding sources to go with Sony full-time and keep her here in South Pasadena that way. But regardless, we still have 24/7 resources available to us through either the HOPE team, the host team, which is that regional law enforcement program. And when that host team comes out, they're not looking for criminal enforcement. They are strictly there to make contact and provide resources to those homeless individuals and the mental health people that we come across. But as Lieutenant Robledo said, if there's crimes being committed, we don't ignore those either, because it has to go hand in hand. So while being compassionate, there's also the enforcement side. One thing I would like to say is we have a lot of grassroots efforts going on in the community, and God bless those people. They provide a valuable resource. However, there is sometimes an unintended consequence with grassroots efforts, and that is it can exacerbate the problem. So when we are meeting people at the Gold Line station and encouraging them to come off the train into South Pasadena because we are going to feed and clothe them, our homeless population just rose. At the same token, a lot of our homeless have criminal backgrounds and behaviors. So we are inviting them into our community. There's an appropriate response, an appropriate place. Our goal when we provide them resources is to provide them long-term care and get them off the streets through, there's different programs that we can house individuals at local motels or county facilities. So just to provide someone resources or money, that isn't necessarily the answer that we're looking for. And from what we've seen, that is not a long-term solution. That is a quick fix that is often turned into some sort of criminal behavior when they're taking money, gift certificates, or whatnot. Even when they go to the restaurants, we've had talks with our local chamber. Some of our restaurants will have panhandlers, and to remedy the situation quickly, they'll provide food or money or whatnot. But what that really does is invite those individuals back because they know, hey, if we stay here long enough, we're going to get money, we're going to get food, we're going to get the things that we want now. And that's not what we're looking for. So we're looking for those long-term solutions. But as we continue to move forward, we want to provide updates not only to the community, to the council, but to the commission, because there's going to be some tough discussions. I mean, this really isn't a law enforcement problem. This is a community problem, right? It's going to take everybody involved to come up with a solution for South Pasadena. One thing that I think some residents don't realize is our proximity to our biggest neighbor is Los Angeles, but we also have Pasadena. When they make decisions or to a moratorium on homeless enforcement or enforcement in the parks, that directly affects South Pasadena. So for instance, Los Angeles created a moratorium on enforcement with homeless, I want to say last year, right before Mayor Bass came in, and we saw on Huntington Drive, the center median looked like a third world country. There were tents, there were barriers. I mean, it just looked really, really bad. And our homeless population in the daytime wasn't 20 or 30. It was like 50 or 60. And of course, our crime went up. And, you know, the unintended consequences from Los Angeles, but it had a direct correlation on South Pasadena's quality of life. And that's what we're seeing now. We just ran into another situation at Marmion Park, which is in Los Angeles, but it is really right on the border of South Pasadena. And according to LAPD and the Rangers there, the city of Los Angeles got a lot of money for the Olympics coming up. They're redoing a lot of their parks. And at the same token, they're pushing their homeless out of the parks. So the homeless are now coming to the very edge of Los Angeles, now into South Pasadena, and we're seeing an uptick. I believe one of our local journalists, Steve Lawrence, is very active in that area, and he was calling the police department. He wants to do an editorial on it. It's a significant issue. So as we look at Los Angeles, as we look at Pasadena, I think it's important for our community to know what's going on in those outlying jurisdictions, because it tends to have a direct effect on South Pasadena. So that's kind of it in a nutshell. Yes, sir. We do. So we track that in our internal CAD system, computer aided dispatch. We have every time we go out or receive a call on mental health, on homeless outreach, all that is tracked. And I believe Sony does also, and she can speak to her activity in just a second, if you don't mind, Sony. I think it's important that they hear directly from you. But yeah, we track all that. We look at, and that's how we also justify when we talk about creating positions within the police department. Is there a need for a full-time homeless outreach person? That's how we look at it. And we, right. Correct.
The funds are gone on that. Those are through the county and the funds are gone on that.
Yeah. LASA, yeah. When we figure it out, we'll let you know. There's so many players involved, as you said. Plus, there's the nonprofits and there's the faith-based groups. So Sony can track the individuals that, and that was part of the disconnect with Sony following up from the San Gabriel Valley Met team and vice versa. So the police department has become the de facto middleman, kind of parceling out, right? Because we're the ones involved more often than not. But there's still that communication gap because you're talking about the Met team is a private company. Sony works for the county. She's trying to follow up. Then it's who's sharing information. And even though it's, we all want to help, we all want to communicate, the chances of us getting everybody is just impossible right now. There's so many people involved in a broken system. We've heard from the supervisors. I mean, they're doing audits on LAHSA. There's missing funding from the county. It's a disaster. And that's why I say it really is a community problem. We can't rely on one person. And certainly the police department is not the entity to take the lead on this. We have by de facto, simply because we're the ones that are out 24/7 and coming across these people. So I would hate to say, but right now we're probably the best and the most capable of doing it, but certainly not the ideal. So yeah, it's a challenge to follow someone unless you have dedicated personnel. And Sony has been our dedicated personnel along with our one officer. So I think we've seen a lot of value in that. That's how we're measuring it. But in the bigger picture, yeah, it's just it's this proverbial black hole that people just get lost in the system, and that's the problem is, and especially when you're talking about this, I hate to use this word, but transient population that continuously moves. And one thing we're exploring in terms of funding is we're looking at a lot of the people we come in contact with call Los Angeles their home, and they're getting forced out by Los Angeles's policies. So we're actually looking at how we can go back to Los Angeles and request funding for helping their population because of their policies. We haven't figured that part out. There's some mechanisms in place, but that is something we're looking at. We're actually seeing the difference in that. And now we're starting to come across a lot of people that are from all across the United States. They're coming out to South Pasadena for various reasons, but a lot of them have said because it is a friendly community, right? I mean, we are providing cell phones, we're providing clothing, we're doing more than any other state to provide for them, which, as I mentioned, like these grassroots organizations, invites more people. But with that also comes other issues, homelessness and crime and substance abuse and mental, and we're just not capable. As a state, we don't have the funding. Certainly as a city, we don't have the funding to meet all those needs. So a couple different ways. So we go out and speak with the chamber at their shop talk probably 3 times a year, and then we provide resources as well. And then we also have our officers that go out and deal, because the members of the chamber are the ones that are typically calling us when it comes to homeless related issues. So at the time we provide them resources as well. We go out there, and then here's a great example is at least once a month I walk the business districts and talk to the individual shop owners, introduce myself, talk to them about what their issues are. 90% of their issues are homeless related, and just establish what programs are available to them, who they can call, who they can reach out to. And as Lieutenant Robledo said, if someone's uncomfortable with calling law enforcement, they can call a number of other numbers, direct the Department of Mental Health, LA HOP. They can call LAHSA. There's a number of different numbers that they can call. And if they don't know where to call, but they don't want to report it to us, they can at least call us and we'll provide them the number of where they can call. So not having the resources is not the issue. So I'm going to let Sony speak for just a second.
Yeah, in terms of case management, when I first joined, we researched the CAD system and we brought up all the 5150 holds or any mental health crisis calls. And over the past 2 years, there have been about 150 holds in South Pasadena. So we followed all of them. At the time, there was a mental health clinician with La Carta. So we divided the calls and we try to follow up with these individuals that were placed on hold 6 months prior. I do maintain a tracking sheet. So if it's a repeated call, there's more intervention needed, but there's more a rapport needed to be built with this individual so that they don't need to be repeatedly placed on holds. I have spoken to Kathy Billings in the library, and so we have coordinated, and she emails me directly if there is a person that is repeatedly coming and is in mental health distress or needs any support. So from our end, the county system also has a county-wide documentation system. So many of these homeless individuals who are not in South Pasadena, they still have a mental health history with the county. So I can access that and know, okay, so this person was placed on a hold. He's not from South Pasadena, he's from LA. However, he has a huge mental health history. Oh, he has a case manager in LA downtown. So then I contact the case manager and he's linked back to services in LA. So that's one advantage. I have access to countywide. And most of these individuals who are unhoused have a mental health history, and we see it. So that's a good way to track as well. And then we note, and then we never see them again. But then they are linked to whatever continuation of services they were receiving in other cities. And we see a lot of them from all over, San Gabriel, LA, everywhere. They're coming to South Pasadena.
Commissioner Huguin, do you have your hand raised, sir?
Yeah, good morning, Lieutenant. Thank you very much, and thank you for the presentation and all that you and your team and Sony, excuse me, all that you and your team do. Just two questions. One of them is a two-part. Lieutenant, how many officers are on the HOPE team, and how is the training that they receive different from what a non-HOPE team officer would receive?
Well, pretty much everybody has been trained to be part of the HOPE team, so they can sign up. We also have the host team where they have to attend a class, and they talk about how to approach people to be um, like a non-enforcement portion of it. So there is training available. We also have training through our we also have training through post.
Yeah, let me just talk a little bit about that. So because we're such a small organization and we come across it so much, all of our officers have completed training in terms of how to recognize mental illness, how to approach individuals with mental health issues, what resources are available. You know, everything you can think of when dealing with that population, from hygiene issues to communication issues. It's a significant part of our training curriculum. And that is simply because not just the host officers, but the entire department. Because what we're seeing is when host officers aren't available, it's the regular beat officer, the individual that's out there in the patrol car doing crime suppression, may be called at a moment's notice to go and handle homeless or mental health issues. So they have to be well-rounded and well-versed, not only in the laws, but those other issues, communication. For instance, when we talk about communication issues, one of the important factors is to slow down speech, to lower your voice, and to create a calming environment, right? We want to gain an individual's cooperation. So if we are not trained in those things, we can quickly escalate a situation that otherwise wouldn't need to be. At the same token, there's also some health issues to consider. Many of these people have social diseases or other issues that the officers need to be aware of. How do we treat those? How do we deal with them? Yes, we can call the fire department, but at the same token, we still may need to go hands-on with them and escort them to the car or escort them to the curb. Those create issues. At the same token, fire department might not be available. Sony might not be available. So we depend on that officer to be able to make those calls themselves. So they go through, like I said, a number of different training scenarios and courses above what the state minimums are. So peace officers are regulated by the Peace Officers Standards and Training, which is the state of California's overlapping or watchdog commission. They set the standards for law enforcement. So South Pasadena, we not only meet those minimums, but we exceed them. And that's simply because of the demand of our community and the standards our police department sets.
Appreciate that, Chief, and thank you, Lieutenant. My second question is, how does our number of 14 people experiencing homelessness compare to past years?
Well, thank you. That's a great question. So last year we had, our, that was, last year's, numbers. This year's numbers, our point and count were 9. But we had as high as, 34 within the last 5 years. So, definitely trending down. And I don't want to jinx ourselves, but I see that our guys are doing a great job in housing people since September. There have been 4 people that I know have been housed. Um, through our program.
One thing I want to explain to the commission, though, is when we're talking about our homeless population, we go out in a point in time count. And that is, we go out one night a year, and we send our officers out to where we think homeless would congregate, and we actually count them. However, we report that to the county, and the county adds a multiplier to it. So depending on where you contacted that homeless person, if it's a tent, and I don't know what the multiplier is, but it might be for every person you contact in a tent, they might had a multiplier of 2.1, assuming that you didn't contact another 2 people. If you contact them in the car, it might be 1.3. Overall, in the end, we average somewhere between 40 and 60 homeless, according to the county. But what we actually count is 14. So that plays a significant role when we're talking about funding. When they publish the reports out, a lot of the community will get the reports and they'll say, oh my gosh, 60 homeless people in South Pasadena. That's a huge population. That's not 100%. I don't want to say it's not accurate. I just want to say it's a different way of looking at the statistics. And those that call South Pasadena home, because we're such a small community and we come across them so frequently, we pretty much know them by name. But I will say that multiplier really does significantly increase the number that we supposedly have. During the daytime, and that we do not count during the day, we only count at night because as well as the county, they understand and recognize that a lot of the homeless travel during the day to go use resources in outside communities. So that's why we choose the evening. And that's when we come, typically, we anywhere between 10 to 15 up to 30 is what we've experienced. And that 30, I would say, was more of an anomaly than anything else. So.
Chief, I know you did mention that potentially looking at seeking restitution from the city of LA. And I think that's something that should be looked at in the future, particularly with the Olympics coming up, because the city of Los Angeles invited them in almost 15 years ago. And we know that with the Olympics coming up, now they are going to try to push them out, and then surrounding municipalities are going to bear the burden of that. So I think that, and the citizens of South Pasadena should support that, because that's going to tax their resources and bring them into the city. So just something to look at prior to the Olympics coming up.
Absolutely.
Another thing, one second, another thing, when we talk about funding through LASA or what have you, they have, they don't just say, okay, you have 16, we're going to provide you for 16. They have a group of numbers. They say 150 and below, we're going to provide you with this amount of money. 150 and above, we're going to provide you with this amount of money through Measure H. Through Measure M. Yeah, through Measure M. So when we talk about 16, 25, if we're under 150, we're going to get that same amount of funds through Measure M. There are definitely more shelters for women with kids or what have you. but I couldn't tell you why the disparity in numbers. Sorry.
One final thing for Lieutenant Robledo. I have watched through several years the great job that Lieutenant Robledo has performed in this task, especially the compassion and the empathy he shows to these folks. And I think that is to be commended.
Thank you, sir. And it is a group effort, and I am very, very proud of the men and women here in South Pasadena that have taken on this challenge. Thank you, sir.
Real quick, Lieutenant Chief, just like to thank you guys for looking at these programs in a broad spectrum from the youth side to the homeless side. Thank you for taking that initiative and participating in these programs, especially somebody that was impacted by the middle school incident. So just good to know that a program like that exists and can now pass that along to other members of our. Thank you.
Thank you for that comment, Commissioner.
Now, moving on to item number 4 on the agenda, Greg Lloyd, Fire Chief, will now make a presentation on the paramedic subscription program.
Good morning, Commissioners. My name is Greg Lloyd, Fire Chief, and I'm just here to give you a brief update on our paramedic subscription program that we have currently in place and is available for our community, for our citizens. So, just a little bit of history on paramedics as well. The Wadsworth-Townsend Act started in 1970, actually created paramedics, created advanced life support service here within the state of California. And in 1975, South Pasadena Fire Department began delivering paramedic services to the community and has been doing so for the past 50 years. One of those things of note is that we are celebrating 50 years of service delivering paramedics to the community of South Pasadena. Ambulance transport. So ambulance transport rates are set by Medicare as well as the Los Angeles County Department of Health. Cost of a transport can be in excess of $3,000. And so as a result of that, we wanted to take some steps to work with our community to help with some of those costs. We work with a third-party billing company for cost recovery on that. That's with Whitman. When I arrived here about 6 or 7 months ago, we did go through a number of different contracts, our EMS QI as well as our ambulance billing, and we're actually able to negotiate with that company to reduce the recovery rate from 7.5% to 5.5%. So we're going to see a cost savings. We saw cost savings on that starting in December and continuing through with that. So basically, the paramedic subscription program, it covers $95 a year for residents, and it covers everybody within the household. So it covers all of the family members. If you have a business, you have it's $106 a year annually, or $106 annually for the businesses. That covers up to 10 employees. What this does is that we work with the insurance companies, and some insurance companies, depending on what they are, cover a percentage of that, and so then that remaining percentage is then the responsibility of the individual. For $95 a year, we waive all of those other fees, and basically so what your insurance covers the entire percentage of the bill. And so to get to that, for access, this is our website, so southpasadenaca.gov. You go to Your Government under Fire. One of the boxes there on the bottom right is the paramedic subscription program. And then basically you fill out the form, bring the payment in with the office. We process that. That goes on a list. That list is shared with our insurance company, and then we go through and take care of that there. Payments can be brought to the fire station during normal business hours. I can tell you that we're in discussions on ways that we can make that electronic so that people don't have to come down. You could certainly also mail that in, mail a check in to the fire department to make those things that are available. We also do send out reminders. If you are an annual subscriber, we will send you out a reminder that your subscription is coming due as a way in case, as everybody gets busy and can tend to forget on that. That's pretty it. It's just a short kind of overview of that program that's available for our community, and I'm available to answer any questions you might have.
Actually, I don't have a question. I have a comment. And I've been a member of this program for the past 2 years. And I am telling you, it is such a revelation because in the past, when we had problems, when we needed to call paramedics or something, we're pretty well insured. However, this did not save us from having to be billed $1,500 for the time the paramedics came. Even though the insurance paid their part, you were still we were billed upwards of $1,500, which can put a significant dent on your budget. Number one, and number two, when people think about paramedic services, they think about, oh, maybe older people, maybe this, maybe that. True, older people have many more emergencies. They constantly have emergencies. They fall, they hurt themselves, whatever. However, younger households, the teenagers, they're always hurting themselves, you know. I mean, it just cannot be avoided. And the one advantage that this service has is when the paramedics come, they take you to the hospital. And the hospital, instead of having to sit in that waiting room for hours and hours and hours, they'll take you right in when you come with the paramedics. You don't sit there for hours and hours being coughed at and hear all these people with these terrible ailments that are afflicting them. You are actually almost guaranteed that you're going straight into a room. So I am telling you, this is such a win-win situation. It doesn't just cover the person that sends the money, it covers the entire household, number one. And number two, for businesses, it's so advantageous. So I highly recommend it. And I think we are very grateful that this program is made available to us here in South Pasadena.
Thank you.
Chief, I wish Commissioner G was here. She's always very knowledgeable in these areas. She's a doctor as well. But her point was always when she speaks in medical issues, this is the community, do they take advantage of it? Is it of this program? It's pretty amazing program. Or are they not aware that it exists, or do they just look at it and then put it aside? Or because that's Commissioner G's point is always, are we getting the word out effectively?
Absolutely. So I can say that probably if we were to look at, I'd have to look at the breakdown, but we take in about $26,000 to $30,000 a year in the ambulance subscriptions. And so if you divide that number, the math doesn't work out to the entire population. So the short answer is no. And so that's one of the things that we're doing and why we're bringing the presentation forth here in a public forum that hopefully people that are watching online can see it. And then looking at ways to market that to our community to make that an option, that it's something that it's at the forefront. It's interesting though, the fire department in general, it kind of is like the insurance, right? You don't think about it until you need it. And so as to your point, Commissioner, you needed it and you understand that. And so most people that have either had an experience with the paramedics or with the fire department understand the advantages of having it there, as to your point. And so we continue to do our best. We can always do a better job and looking at educating and marketing that to the public, and we'll continue to do so. Right. Right. Yeah, I mean, just a basic math, I just did it on my phone. It averages about 273 people that are subscribing. If it was all just residential, not including any businesses. We certainly, whenever we can, make the opportunity available. And then ultimately, it's their choice. It's an opt-in for what they, whether or not they want to choose to participate in that program. But we certainly, can uh, provided with staff time and that, look into that aspect of it and do it, find out where the undersubscriptions are.
Chief, congratulations on 50 years of paramedic service here in South Pasadena. I hope there are other opportunities to celebrate the EMS care provided by our medics and EMTs over the course of this year.
Thank you.
Morning, Chief. I just had a question regarding the program. If I was to sign up and does it include transport only from my residence? Would I have to be at my residence, or could I be at the library?
You could, absolutely.
Okay.
So
I mean,
so it's regardless of where you transport from, but you as a community member will do to that. And then, here's another example is that I'm sure, with your familiarity with Verdugo in the system. And if another agency comes in, so we use the mutual aid system. So for instance, San Marino, their ambulance comes in and transports, we will still honor that subscription piece. So all we do is we communicate that through, and then as a member of South Pasadena, then we work those pieces through. It might take a little bit with that, just as to make sure that we connect all the dots, but we want to honor that piece too.
no, that's great. I think that that's something that definitely needs to be published and made aware a lot more, that you're not just providing or obtaining this subscription for just your home, but it's wherever you are within the city of South Pasadena. I think that's very useful.
Right.
You got to get the word out.
Absolutely,
Okay.
yes.
What I think is the problem is we are bombarded with so much junk mail, junk information, and people just disregard this. Many times they feel like, oh, just somebody else trying to sell something to me. But I am telling you, this is a win-win situation. There is no way to go wrong. That's the best $95 that you ever spend in the whole year. So I highly recommend it. I make a point of telling the folks at the senior center that this is available and sign up, as well as my students in my class. You need to, but it's one of those things that we're very fortunate that we have this program here.
Absolutely.
Oh, Chief, sorry, is anybody talking? I can't.
I got you. You're good, Commissioner Hoagland. Go ahead.
Chief, appreciate the presentation. Thank you. You answered my first question of whether mutual aid cities honor it, so thank you for that. My next question, I don't really know how to phrase this. It's definitely a great program. I like the chair subscribe to it and have for the past few years. Luckily, I've never, knock on wood, needed to use it. But do we come out kind of even at the end in terms of costs? I'm sure there are people who subscribe that don't use it, but the amount of revenue that the city would generate without this program, obviously I'm not advocating against this, just trying to figure out the budgetary impacts of it.
Yeah, I mean, we definitely have to look at the particulars in that. What I can tell you, just as far as the raw data and going over the numbers, so in 2024, we brought in just short of $1 million of revenue through just ambulance transports in general in that. And then that 26,000 of that also is part of those, as part of that ambulance subscription part. So there's an addition. Those are also parts of savings that we're helping with the community through that. Whether it's, whatever the copay is, $50, $100 or more, then that's depending on what the insurance company will actually charge, and that it varies so dramatically, which is another advantage of the subscription program because it evens out, and especially for folks that are on a fixed income uh, unanticipated charges are the ones that kill you. And so having that $95 once a year and then knowing that there isn't going to be anything else, it does a lot to help our community financially as well as providing the care and the community service. Yes. I can certainly provide you the numbers in looking at that as far as that goes. It's going to be difficult to compare because the insurance reimbursement is so varied amongst. We might be able to look at Medicare and in terms of what somebody saves by doing the program versus what they would by not opting in and what they. Mm-hmm. Mm-hmm. Right. Mm-hmm. So as far as impact to the city, if I'm understanding what you're asking correctly, so the essence of the program is that by subscribing in, you are not responsible for the copay of what the ambulance would be. So let's just say if an ambulance bill was $3,000, your insurance would pay, you know, 2,500 of that. So then the city gets that 2,500. And then the way the billing service goes is then that $500 bill would then go to you and you're responsible for that. And then, but if you're subscribed, then that $500 bill is not. So it's then we're waiving in that. And if that's what you're looking at, it's a benefit mostly to the community to pay into the subscription service. So they're not having to have that remaining copay cost, yes. Yes. Right. Mm-hmm. Yeah. Right. Mm-hmm. Sure. Mm-hmm. Mm-hmm. Yes, certainly. And we get monthly reports from our billing company that does that. And our billing company charges a percentage of the fees collected. So there are write-offs, we get, overdue, what's 30 days, what's 60 days, what's 90 days, what's been negotiated down, all of those reports that we can make available. Yeah. You're welcome. Awesome. Thank you for your time.
Thank you, Chief Lloyd. The next item we have is the minutes of the Public Safety Commission regular meeting of December 9th of 2024. My question here is, do we have a quorum so we can have a motion to approve the minutes?
Yes, we do, Chair Cervantes.
We do have,
Yes.
okay. So do we have a motion to approve the minutes?
Motion to approve minutes. Do we have to do individual months or all together? Okay, I'll make a motion to approve the minutes for December.
I second the motion.
Chair Cervantes,
Yes, present. Approve.
Vice Chair Munoz,
Approve.
Commissioner Reza,
Abstain.
Commissioner Senko.
Approved.
I don't think we can pass the motion because we have only three.
Is Commissioner
Commissioner
Holguin?
Olin,
Commissioner Liu is also, I saw his name on there.
Commissioner Liu is not on Zoom right now, but Commissioner Holguin is. Commissioner Holguin, can you hear us?
Yes, aye.
Okay, motion passed.
so at this time, is the motion approved?
Yes.
Okay, so moving on to item number 6 on the agenda, minutes of the Public Safety Commission regular meeting of February 10th, 2025. Do I have a motion to approve the minutes?
Motion to approve?
I will second.
Roll call?
Chair Cervantes,
Yes?
Vice Chair Munoz,
Yes.
Commissioner Reza,
Yes.
Commissioner Senko,
Yes.
Commissioner Holguin,
Yes,
motion passed.
Motion approved. Moving on to item number 7 on the agenda, discussion of the need to change future dates of Public Safety Commission regular meetings. And we'll have a discussion at this point. What are the options we have for times?
Chair Cervantes, I presented the commissioners and Council Member Ferguson the calendar of council chambers, the availability dates. So it is up to the commission whether you want to come up with a new date or specific dates for future meetings and times. So that way it'll be easier for you to make a decision. But I'm not sure if you'll be able to make a decision at this point.
Commissioners, if I believe you received earlier in the week a poll on some options too, which would look at today's every second Monday, keeping it the same, just changing the time. I believe it was 9:30 and 3:30, and those were the preferred dates and times. But if there's something that you want to look at or discuss, you were also provided calendars with availability to this facility.
What I wanted to say is I'm retired, so my choice is 9:30. However, I'm wide open to accommodate the rest of the commission, and I think Vice Chair Munoz feels pretty much the same, no?
That's correct.
Yeah, he doesn't work anymore.
Mr. Chair, members of the board, was it the idea to have the time change to allow participation from the community at later times, or was it just conflict with schedule?
The intent was, it was a conflict with the council liaison, and he had asked that we consider changing the times to facilitate his schedule as well. So,
Okay.
Chief, and also, in addition to the councilman's request, I'm available at any time, but I think I mentioned the last meeting that members of the community had also expressed some concerns about the morning, this early in the morning, they had trouble seeing the meeting, observing it. So is that still an issue, or was that the joint session of the council we had about not quite a year ago, 8 months ago? Is that still a concern, or?
it hasn't been brought up since. I
Okay.
know traditionally the timeframes, being that it's in the morning, has made it difficult for members of the community. It's just most of our community work. And so when we're taking that in consideration, yeah, that is an issue. But we also need to look at what the availability, it's very challenging considering the availability of this facility, which is where commissions are held because it's televised and whatnot. So there are other commissions that are held in the evenings in this facility. So we need to maneuver carefully around that as well to make it, to accomplish all that we want it to.
Mr.
Commission,
Yeah,
go ahead,
sorry.
Commissioner Hogan.
Yeah, appreciate it, Billy. Thank you. Mr. Chair, if I may, just two things. Number one, I want to point out, we are missing a few, so I don't know if we can proceed without I mean, I'm sure we can proceed without their input, but we may benefit from their input. Number two, to the chief's point about the poll, my understanding was that was just for today's meeting. If it was voting on meetings going forward, I may have voted differently. I would advocate for what it's worth my understanding is all of the committees meet after the traditional work hours around 6:30 or 7. Not having the benefit of the schedule that David provided, I would advocate for something in that time frame if it is agreeable to my fellow commissioners.
I'll definitely email you the schedule as well, Commissioner Hogan.
Thank you, David.
Since there seems to be no consensus at this point, just a recommendation is that we hold this over for another meeting. We could allow the other commissioners to chime in, send out another polling request. As the council members suggested, there are a couple of commissions have consolidated, reducing the time. We haven't realized that yet in terms of scheduling. And we'll hold this over. My recommendation is to hold this over until such time. And that way we can provide a better outlook. And I would suggest, since we are meeting at 9:30 in the morning, if that works out in the meantime, that we continue that unless the commission has other thoughts.
In the meantime, I think perhaps we should stick with that time. And what I tell you for sure is it's going to be very hard to get all the commissioners at one time to discuss the issue. I just talked to some of the other commissioners, and they said that they're busy the rest of the afternoon and whatever. So I don't know if that is going to be an option. Perhaps the best option would be for us to vote on an email where they were given the option of what time it would be convenient for the majority and go with that. But
Well, just for clarity, it would be, we're not voting for it. That if we send out an email, it would be for polling only. We will take an official vote here, official action as a commission.
Okay, that sounds good. Yeah.
Okay. So just to clarify, we will continue at the Public Safety Commission as is, 9:30, and throughout the next month, we will poll the commission to see what time works best and see about altering it at that time. Okay. Thank you.
David, there's no motion needed for this, just going.
No, no.
Moving on to item number 8. On the agenda, Public Safety Commission 2025 Work Plan. Brian Solinsky, Chief of Police, and Greg Lloyd, Fire Chief, have submitted the final work plan for adoption.
Thank you, Commissioners. The work plan that you have before you is the plan that was submitted and discussed at the last meeting. This will be to finalize it. There was one couple changes, I believe, that Chief Lloyd made.
I thought the changes reflected in there. Yeah, so the only thing was just a change of moving some things around in the schedule. I went ahead and moved CERT to more towards the summer, and then that fire prevention and safety was an update in April. And the reason I wanted to we did that, so we're slated in March 26 as part of Southern California to receive the rollout for the new fire hazard severity zone maps for the local responsibility areas. This is something of important note, especially among the Monterey Hills. The state fire marshal will be coming out with those new maps and has added 200 cities to the very high fire hazard severity zones. That's an important note for us because two things is one, we're required to publish that map within 30 days. And then we're also required within 120 days to adopt that map by ordinance through the city. If we are redesignated in the Monterey Hills as a very high fire hazard severity zone, there are some changes with regards to brush clearance, with regards to construction that are pretty significant. So we'll be working on a public education program with that. They were originally designed to be rolled out in January, but the fires that happened in the LA area, the Eden and the Palisades, the state fire marshal held off on that. And so they're now doing a phased rollout. They started at the beginning of the month in Northern California, and they're working their way south. So once we get those maps, so we want to provide that as an update to the commission. Yes, March 24th or 26th. It's that last week in March. No, it's in within the next 3 weeks. Yes.
So one thing I wanted to add is, although this is the work plan for the year, this schedule is very nimble. So staff and/or the commission can request and add if there's something significant that comes up in the community or something that needs to be addressed. We can certainly work around that and add it or remove anything that may be needed. So it's a very flexible and nimble work plan.
Chief, so unfortunately, I missed the last meeting. Is it possible to suggest another item to be included in this, perhaps in the empty May slot?
Absolutely.
And what I would propose to my colleagues is I also work as the vice chair of the county EMS commission. And one of the items that is being explored right now is cardiac arrest metrics. Cardiac arrest is kind of the archetypal pre-hospital emergency. As you guys are aware, 80–90% of most 911 provider agencies, fire departments work is medical care. And there have been a number of studies showing that those organizations that do great in those communities that do great in this entity, cardiac arrest, tend to do well in many other pre-hospital emergencies. So from the county's perspective and from the county commission, there will be upcoming expectations, both of our 911 provider agencies as well as from our local hospitals and hospital systems. And so perhaps we could occupy this date simply to discuss that issue. And I'm happy to speak to the work that's being done on the EMS, the county EMS commission, about what the forthcoming expectations will be over the coming year. So it wouldn't be a ask of the fire department of where are we at right now. It would be more of a highlight for everybody about what is coming in the months and the coming year to come. So would that be something that we could perhaps add?
Absolutely. So when it comes time, if you make a motion to accept the work plan as is with the amendment that we add cardiac arrest information on there, 100%. Yeah, we could add that.
Would it be okay to make such a motion right now?
Yeah.
Great. I'd like to make a motion that this work plan be accepted with the amendment that for the May meeting, the objective of community approach to cardiac arrest be included, and that the task and activity be exploration of current status and unmet needs for resuscitation at a community level be included, and that the lead person be Chief Lloyd, and I don't know if it's possible to include a commissioner. If so, I would include myself as the lead person.
I second the motion.
Chair Cervantes,
Yes.
Vice Chair Munoz,
Approve.
Commissioner Reza,
Yes.
Commissioner Senko,
Yes.
Commissioner Holguin,
Yes.
motion approved.
What do we do about the,
We have one question.
yeah,
Correct.
okay, so we can move on to the next item? Or do I have to approve the Public Safety Commission work plan?
No, it's approved already with an amendment, so we can move on to the next item.
Okay, fine. Moving on to item number 9. Let's go to City Council Liaison Communications.
Absolutely. I don't think we need to add that to the work plan. That's something that we can do as a presentation from the police department perspective to the commission and. Some of those would not fall under the commission guidelines, so those would be more council policy decisions when it comes to vehicle purchasing. Should a policy be established by council and we're going to purchase, we could present to the commission, but to present a policy now, that's a council directive to staff. But that's a council decision. So once council gives that direction, happy to. Correct. So there's some legal challenges to that, and the first being HIPAA violation. So we're not quite there yet. I don't know of any city that has that program in place. Simply, at least I'm not aware of it, because of those legal challenges. There are certainly ways around it in the sense that we can tap into local resources like our seniors community center for membership, and we can reach out to them. But as far as specifically identifying marginalized groups or people with healthcare needs, that's a legal challenge that we worked with the city attorney, I want to say 2 or 3 years ago, and ran into some significant challenges. Haven't quite worked through that yet. So I don't know that there would be a viable option at this point. But something that is on our radar, something that we, as I mentioned, can work around through other resources to try to identify those groups that may need help in the event of an emergency. There's certainly, and I don't know, Commissioner Reza, if you know of any program to identify in your professional.
No, Chief, off the bat, there's nothing that comes to mind. But just the security aspect of it, no.
Right. Right. Yeah. Right. Mhm. Certainly, and I think our initial phases and our plans right now is going to be an opt-in type of thing that, so with along these lines with the fire hazard severity maps and all of that and our plans to really create a comprehensive preparedness plan for the community. Part of that's going to be public education and part of that's going to be an opt-in, and it's not going to be anything as far as protected health care. It's going to be, are you going to require assistance in evacuation? And that's it. It's going to be a yes or no thing. And then that information will be publicized, but we still have to walk through what that policy looks like so that we can be protected. And that'll be, once we get these, the maps have kind of been this whole thing we're waiting on, and then we'll start moving through from that piece. But as if you were to ask me today, it's going to be part of the public education that we present to the community with the maps, with an evacuation. And then, hey, if you need assistance, we need to know. All we're asking is, what's your address? Check the box, yes or no, you're going to need assistance. We're not guaranteeing it, but what it does is it provides us an idea that if there is an evacuation order, then these are people that aren't going to be able to get out on their own, which, yeah, we've seen typically in the past.
So I think Chief Lloyd just mentioned it is do we create a level of expectation? And then what are the legal ramifications with that? So that's one of the other challenges we came across the last time. So really, it's more of a legal issue and would require the city attorney. I hear you. I think it's a great idea. It's just, how do we implement it effectively?
I also know from like the senior citizens, many times, like when we have the Meals on Wheels program, many of these folks are in their homes and they cannot go out. They just are not mobile. And so we have, through the senior center, we have a list of who is shut in. We call them shut-ins. So if we could somehow, without infringing on their privacy or whatever, have something available so these folks can be helped in case we need to mobilize or evacuate a certain area.
And that's why I mentioned there are other resources, that being one of them. Senior center lists, certainly there are ways to get that information. may not be the most accurate, but we also want to be considerate of, as you just mentioned, the legal privacy issues, the HIPAA violations. There's a number of challenges. Not saying it can't be done. I'm just saying there are challenges that that's why they haven't been implemented as of yet. But we will certainly work through that. We'll contact our city attorney. It is something we've talked about for years. I think it's a valuable program. It may be an opt-in, but we're just not there yet in terms of being able to find a viable solution. And certainly working with Edison, that's just another avenue that we might be able to explore. But something that I think our city attorney is going to need to weigh in pretty heavily on.
Moving on to item number 11 on the agenda, staff liaison communications. He's tired. He's tired.
No, I think we've covered it all in the presentations. Thank you again for your time and your participation. And so we really appreciate that.
Just from the law enforcement side, I just want to remind everybody, we're getting into the summer months. Typically, summer means people stay out later. When people tend to stay out late, crimes tend to happen. So just a reminder for the commission, everyone that's watching, is please lock your stuff, cars and your windows. And I know it's tempting in the summer months. The weather gets nice and we want to leave our windows open at night or throughout the day. But today's day and age, we just can't do that anymore. So common sense approach, don't leave valuable things in plain sight, park in well-lighted areas, lock your cars, double check, those type of things. And if anybody has any questions or wants to know what the best way to harden your home or your business is, please reach out to the police department. We're happy to send someone out to walk through your property, give you ideas on how to make your home a theft-proof or at least a little more resistant to theft and crime. So we're happy to do that. That's all I have. Thank you.
Thank you. Now we have commissioner communications. Do we have anything? I have something. It has come to my attention that the children from the middle school had brought up into the city council the idea of having stop the fireworks as they have been all along. We're talking about because we had these horrific fires and fireworks in the hands, especially in the hands of people who just buy them and just throw them any which way. It can make a terrible, terrible situation. I think it's very commendable that the children from the middle school are looking into this. And I would like to ask my fellow commissioners, I feel that this is so important as far as, number one, safety, number one. However, number two, it is so horrific for anybody that has pets, the noise that is caused by the fireworks. The poor animals suffer and they're terrified. If you check with any of the Humane Society, it will tell you that's when the dogs, the animals, escape from where they are because they are so terrified. Number three, our air becomes so polluted with all these explosions, with all this powder floating around for the next few days. And somehow, having reading about all these horrendous things going on in the world, like Ukraine, I just don't want to live in an area where I feel like I'm in the middle of a war zone. Yeah, and that's the feeling you get all night when the explosions go one after the other. So I would like to commend the children from the middle school. And I would also like to bring up emotion. Maybe my fellow commissioners would be interested in taking a vote at a time that this is going to be discussed at the city council on the 19th, I believe. But if we could have meet or take a vote or do something before the 19th, supporting that, that is something that is so important that it would be supporting our fire department and our police as well. So I think this is a very, very important issue. And of course, if you ask what is 4th of July without fireworks, well, the thing is, right now we have drones that perform beautifully. And in many capitals around the world, like Sydney and in some of the places in Germany and other countries, they have the drones and they put on such a beautiful displays of lights. So it is doable. So what I'm asking is if we could ask the city council when they vote on this to keep in mind their minds open and to see this is something that doesn't have to be continued and it can be improved. We can still have the beautiful lights without all the pollution, without the noise, and without terrifying the animals as well as the children with disabilities, especially autistic children, that those explosions just terrify them. So I want to ask my fellow commissioners if they have any suggestions on how to do this, how we can input this, and as well as Chief Zolinsky.
Thank you. So since this item was not put on the agenda, there's no action that can be taken on it. However, you can ask for, as individuals, you can write in your support or otherwise. But if you wanted to voice your opinion as a commission, you would have to take action, which would mean you'd have to do a special commission meeting before next Wednesday, the council meeting on the 19th. So if that's something you would like to do, you could make a motion for a special meeting. And if you get support, then we could work with that.
Chief, is this for the fireworks show on the city council agenda for next?
Correct. So,
Okay.
so it's on the agenda already, and they'll look at the community services division is presenting a staff report to the council that is highlighting the benefits of a drone show. Of course, there's a financial impact and there's a number of things that'll be discussed. But as Commissioner Cervantes was saying, if you would like to take a vote and as a commission voice an opinion, then that would need to be an action item on an agenda because the public would have to be noticed and have an opportunity to speak on it if they want.
And just so I understand, since we're not going to have another meeting before that city council meeting, it still would be possible for individual commissioners to be present at the commission and make an open comment if they so desired.
Correct. Individually, as citizens, you're more than welcome to go to the council meeting or write in your opinion on it. But if you wanted to do it as a body, then we'd have to have a special meeting before that Wednesday. And certainly that's your prerogative. We could make that happen for that specific item. Yeah, but that would be after the council's vote. So certainly you could do that, is bring it up and we can agendize it at a regular meeting, but to Commissioner Cervantes's point, it would be after the vote.
Yeah, I believe that from my perspective, hearing what the city council has to say, I would like to see the meeting and maybe attend the meeting to get their perspective on how they want to proceed with that before I do anything further.
I agree. I planned on attending that council meeting also, and if I feel the need to say or express my concerns, I will do that at city council.
Very good. At this point, I think we are finished with this, and we're going to go to, with no further items or comments from staff, I will adjourn this meeting at 11:45 a.m. and to our next regular meeting. When is our next regular meeting? April 14th. Okay, our next regular meeting on April 14th at 9:30. Thank you.